How are you? I hope you're having a great day. If you have fibromyalgia, well, you know that muscle pain is our biggest issue, along with tenderness, stiffness, and sensitivity to touch. We have tender points, but some of us may also have myofascial trigger point issues. Perhaps, at least for some of us, massage might help alleviate these symptoms, at least for a short time. And I think massage is a great way to treat ourselves to an enjoyable, sweet pleasure. What do you think? I mean, since there isn't a cure for fibromyalgia, we have to search for those things that give us pleasure and make our muscles feel better. Our nervous system is constantly on high alert, so we need things that don't trigger more pain. I look for ways to naturally incorporate pain management into my everyday life and help to alleviate pain for that little moment in time. I'm thankful for any amount of alleviation of my symptoms. About 98% of us use complementary medicine, and about 44% of people with fibromyalgia choose massage. However, I have heard from several people with fibromyalgia that they're unable to get a massage. So if that's you, put that in the comment section below and let's have a discussion about it. But if you're like me and you love getting a massage, I'd like to hear from you. What do you like about it? There are different types of massage, and I'll talk about a few of them that have been found to be helpful in fibromyalgia. I tried my best to choose just the most important things about massage in this video. I might have overdone it, so please bear with me. But that's what I'd like to talk about today. Here we go. Massage therapy can relieve headaches, improve sleep quality, and increase our hours of sleeping, improve our health status, improve our quality of life, reduce tender points, decrease use of analgesics, decrease cortisol levels, decrease stiffness, decrease fatigue, and alleviate symptoms of anxiety and stress, as well as soothe our muscles. On top of all that, it's easy to maintain as an integrative treatment plan. The benefits of massage therapy might be possible due to the complex interaction of both physical and psychological patterns. When a massage is performed, soft and connective tissues are stimulated with biochemical changes in our body. Muscle flexibility might improve and modulate mood and lymph circulation. As a result, nociceptive, which relates to the detection or sensation of pain, and inflammatory mediators may be absorbed. Serotonin levels may also be modulated. In a 2014 study, researchers reviewed the literature to determine the effectiveness of massage therapy in fibromyalgia patients. The review involved only studies of high quality. Pain was found to be significantly reduced with a massage of 5 weeks or more. Anxiety showed significant reductions with massage of 5 weeks or more, although a subgroup of fibro patients showed no reduction. And the same for depression. That just goes to show how different we are in our fibromyalgia journey. However, the evidence was positive in most people with fibromyalgia. In a 2018 study, fibro patients completed a 3-month study of Swedish massage therapy with 24 different sessions. 24 participants' quality of life, stress, and pain were reduced. In a 2019 study review of the literature, a multidisciplinary approach was used. They look at pharmacological measures, lifestyle modifications, and complementary approaches. As far as exercise, aquatic therapy showed moderate to strong evidence for pain reduction and improved quality of life. The most profound improvement was with myofascial release, a type of massage therapy. It improved pain, fatigue, stiffness, anxiety, depression, and quality of life. However, Swedish massage was not found to be helpful. It's known that people with fibromyalgia may have areas of muscle that are painful to palpation due to the presence of taut bands and the generation of a referral pattern of pain. These areas are called trigger points. A trigger point is in a more restrictive regional pattern and is indicative of myofascial pain. These tender points are usually widespread in fibromyalgia patients. These are areas of tenderness occurring in muscles. Muscle tendon junction, bursa, or fat pads. But the two can coexist. So depending on your need, each of these treatments may work differently on all of us with fibromyalgia. So let's start with Swedish massage. It's a combination of 5 different types of strokes, including long strokes, kneading, rolling, and circular movements. It's meant to encourage both relaxation and blood flow to the heart. It can also loosen joints and reduce stiffness while reducing stress. It's considered a softer type of massage, but it does combine kneading, gliding, sliding, beading, and friction. I'm not sure I've ever had a Swedish massage, nor am I interested in going that route, but you might love it. Deep tissue massage is like Swedish, but with stronger pressure. It's focused on manipulation of deeper tissues and muscles. It can relieve soreness or tension in the muscles and tissues, but can result in lingering soreness. I'm not sure that might be the right fit for us either, but maybe you like it. Shiatsu is a Japanese therapy. It's pressure on specific bodily points and continuous rhythmic motions. Hot stone massage uses heated stones on key points of the body to provide soothing heat to help relax muscles and ease pain. But it's also often used with other techniques. Trigger point therapy involves concentrating on the painful spots located in bands of muscle fibers. People with fibromyalgia have more than people who don't have fibromyalgia. Finger pressure is used as well as kneading the muscle. Myofascial release involves gentle, sustaining pressure into connective tissue. The fascia is the thin casing of connective tissue that surrounds and holds every organ: blood vessel, bone, nerve fiber, and muscle in place. Fascia is tough and elastic. When we get stressed, the muscles contract, and it's believed that the fascia can create tiny knots or adhesions that act as trigger points. also constrict the muscles and decrease blood supply, which then causes pain and decreased range of motion. Myofascial release increases blood supply and can relieve pain and tightness in the fascia and reduce pain and stiffness in fibro patients by increasing tissue flexibility and joint mobility. Sustained pressure can loosen and lengthen constricted fascia. Cupping therapy is often used with it. Then there's cranial sacral therapy. It's a technique applied to key areas of the skull and around the lower spine to improve muscle function. Lastly, reflexology concentrates on just the hands and feet. Short bursts of light pressure are used. The thought is that the whole body becomes relaxed with this treatment. All massage therapists are not created equal. They attend schools that may teach specific techniques or perform a variety of techniques. Like working with medical doctors or physical therapists, it's important to be open and honest during a massage. There's nothing worse than walking out of a treatment feeling worse than when you went in. How much pressure your muscles can endure must be communicated. Some of us are so sensitive to touch that even the slightest touch may be too painful. The masseuse needs to know that you have fibromyalgia. Communicate that. That's crucial. And if you have specific painful areas, communicate that. Massage is supposed to be relaxing and enjoyable. It's non-invasive, but sometimes it can feel intense and discomforting when the ribs, joints, and muscles move in ways they haven't been able to for a long time. You should feel comfortable communicating with them to ensure you get a soothing, therapeutic experience. But a massage therapist is trained not to force or injure the muscles and tissues. But as the body allows these areas to move, it might hurt. Afterwards, it should feel amazing. If you have fibromyalgia and maybe also have arthritis, a frozen shoulder, back pain, tinnitus, sciatica, pelvic pain, carpal tunnel, spinal disc issues, or chronic fatigue, you may find massage to be quite relaxing. After the massage, you might feel floaty or relaxed. If muscles or trigger points are massaged deeply, you may feel a little off afterwards, but the therapy releases toxins and free radicals that were stored there. You may even feel a little sore in places. A hot bath, if you're able, if not a lukewarm bath, maybe with Epsom salts, may relieve the soreness and relax you to sleep. The first 24 hours after your treatment, you may notice some aches and pains on the body as it flushes out the toxins. It's like doing a heavy workout in a gym and then afterwards you experience temporary soreness. You need to drink a lot of water and keep yourself hydrated. If you experience muscle twitches or tremors, pulsations, or heat as the blood flows back to those starved regions, it's normal for about the first 24 to 48 hours. But if it lasts longer than a day or two, consult your medical professional. You might also feel a little more emotional as your body is healing. This is normal. Epsom salt baths with relaxing essential oils may soothe your muscles and your soul. You may also experience vivid dreams following a session, or may have an extended period of dream sleep. That's okay too. Let the healing begin in your heart and in your body. When I had a frozen shoulder, I said, it hurts so good, because I knew the benefits of the massage was going to be worth it. Slow and gentle manipulations are what will release the fascia. It can take time. You may not notice a dramatic improvement overnight, so you have to be patient. But when you go into a massage therapy room, you should experience warmth and the smell of essential oils or candles. It should be calming. You need to tell your therapist where it hurts and what you want worked on. Be honest and let them know you have fibromyalgia. When you lay on the table on your tummy, which might be difficult if you have back issues, but you can do it. You need to relax. Close your eyes and allow each muscle to relax. In fact, many people actually fall asleep during their massage. It's a compliment to your therapist. If you're tight and tense, the treatment will be harder on your body. You don't need to talk. Just relax and enjoy it. Your massage therapist will work his or her magic. And when you get up and get dressed, you might feel a little lightheaded, so sit and allow yourself to work through it. Your massage therapist should be understanding and comforting. I love the oil on my skin. When they apply the oil, they're also checking to see how much pressure you can handle and check for any lumps. I asked my massage therapist what technique she used, and she stated she used whatever worked for each patient. She will find those painful, tight lumps, which are a buildup of lactic acid in the muscles, and work them out, allowing adequate oxygen back in. Knots are usually found around the scapula or the lower back. They won't be able to remove all knots in one visit, so be aware of that. But I can honestly say it's never hurt me. But that's me. I understand that. I do understand the benefits. And when I'm done, I feel wonderful. Releasing those toxins improves our health, lowers our stress, and increases relaxation. And isn't that the point? I hope you learned something. I send you gentle hugs and support. Love you. Integrative treatment. Which relates to the detection of that may teach specific techniques. The masseuse needs to know that you have fibromyalgia. And if you have specific, that just goes to show how different we in a 2018 study, fibropatient was used with pharmacologic measures. However, Swedish method determined that deep tissue bodily muscle. This night, they attend schools that may teach specific techniques. And if you have specific, you may find first 24. You may also or may have an exterior. She will find those painful type lumps